Sakthi Dental Clinic, Mullukurichi. Gum grafting is a dental procedure that involves the transplantation of healthy gum tissue to areas of the gums that have receded or become damaged. Gum recession can be caused by a variety of factors, including periodontal disease, aggressive brushing, and genetics. During a gum grafting procedure, the dentist or periodontist will take a small piece of tissue from the roof of the mouth or another donor site and graft it onto the area of the gum that needs to be repaired. The graft is then secured in place with sutures and allowed to heal. There are 3 types of gum grafting procedures. 1. Connective tissue grafts. This is the most common type of gum grafting procedure. During a connective tissue graft, a small flap of tissue is removed from the roof of the mouth and then the connective tissue underneath is removed and grafted onto the area of the gum that needs to be repaired. 2. Free gingival grafts. This type of gum grafting involves taking a small piece of tissue directly from the roof of the mouth and grafting it onto the area of the gum that needs to be repaired. 3. Pedicle grafts. This type of gum grafting is only possible in certain cases where there is enough healthy gum tissue adjacent to the area of the gum that needs to be repaired. During a pedicle graft, a flap of healthy gum tissue is partially cut away from the adjacent area and then pulled over and stitched into place over the area of the gum that needs to be repaired. Gum grafting can help to reduce tooth sensitivity, improve the appearance of the gums, and prevent further gum recession. It can also help to prevent bone loss and tooth loss caused by gum disease. Thanks for watching. Like and subscribe.